Hello, my name is Jose Enrique Arauz, and I will talk about cutaneous leishmaniasis. Definition: cutaneous leishmaniasis is the most common form of the disease. It usually produces ulcers of the exposed parts of the body, such as the face, arms, and legs. There may be a large number of the lesions, something up to 200, which can cause serious disability. When the ulcer healed, they invariably leave permanent scars, which are often the cause of serious social prejudice.
Leishmaniasis is a disease caused by a group of protozoan parasites called leishmania. There are over 20 different species that can infect humans. Across the world, there are about 1.3 million new cases of leishmaniasis every year, causing about 20 to 30,000 deaths. It affects some of the poorest countries in the world. The leishmania parasite is transmitted to humans through a bite of an infected female sandfly. There are over 90 species of sandflies known to transmit leishmania parasites. Sandflies can get infected when they bite a person or animal infected with leishmania. There are many animal species that can carry the parasite, including rodents, dogs, and foxes. Very uncommonly, leishmaniasis can be passed from person to person through blood transfusions, infected needles and syringes, or congenitally from mother to baby. Not everyone who gets infected by leishmania parasites develop the disease, and people can be infected with leishmania without showing any clinical signs or symptoms. There are 3 different clinical types of leishmaniasis: cutaneous, visceral, and mucosal. Cutaneous leishmaniasis is the most common type and is characterized by sores on the skin. These sores usually develop within a week or up to a few months after the bite of the sandfly. People can develop one or multiple sores on the skin that can look like a bump, nodule, or an ulcer. People may also have swollen glands near the sores. The sore can lead to scarring or secondary infections. Visceral leishmaniasis, also known as Kala-Azar, is the more severe form of the disease. It can develop from 10 days and even up to years after the bite of an infected sandfly. It affects the internal organs, usually the spleen, liver, and bone marrow. People typically present with episodes of fever, weight loss, anemia, and enlargement of the spleen and the liver. Mucosal leishmaniasis is a less common form. It can lead to partial or complete destruction of mucous membranes in the nose, throat, or mouth. It can sometimes occur as a consequence of cutaneous leishmaniasis. The disease can be diagnosed by performing blood tests that look for antibodies against the parasite or by urine testing. PCR tests can identify the parasite based on its genetic fingerprint. The best test is identifying the parasite through a microscope. There are many different types of medication available to treat the diseases. Which one to use will depend on the person, type of disease, and severity. So how is leishmaniasis prevented? Well, there are several different ways. The best way to prevent leishmaniasis is to avoid being bitten by sandflies. This can be done by using insect repellents, insecticide-treated bed nets, wearing appropriate clothing that covers skin, and avoiding outdoor activities during times when sandflies are more active, which is usually between dusk and dawn. Screens are useful, but because the sandfly is smaller than a mosquito, they may be able to get through small holes. Early diagnosis and treatment can prevent complications and reduce the burden of disease in the community. Various vector control programs have been implemented in several countries to eliminate the reservoir of the disease. There is currently no vaccine to prevent against this disease. For more information, have a look at the websites below.
Application in medicine. The treatment of the disease must be carried out under medical supervision. Permanent antimicrobials such as sodium glutamate or meglumine antimicrobial are administered intravenous or intramuscularly in a single base dose. Plastic surgery may be needed to correct position infiltrate that may have occurred on the skin from scars in a cutaneous leishmaniasis.
Visceral leishmaniasis occurs in Africa, Asia, and Brazil. In Africa, there is a rapid diagnostic test for the disease. To confirm the diagnosis, a blood test, or a spleen or bone marrow biopsy is required. These tests can only be carried out in well-equipped laboratories, which aren't available in rural areas.
I found out my child was sick because he was vomiting and had a fever every night. We took him to the hospital in Adong. It was after he was sent to Malakal that we found out he had Kala Azar.
Since 2010, doctors have been prescribing a 17-day treatment using two drugs, meglumine antimoniate and paromomycin. By cutting the duration of treatment in half, the burden is reduced for patients, the staff, and the facilities. Severely ill patients, the elderly and pregnant women, receive a different treatment because meglumine antimoniate has poor results and increases the risk of death in these patients. It is very difficult to treat patients co-infected with HIV and visceral leishmaniasis. They are never fully cured of visceral leishmaniasis and will always be at risk of recurrence. In Asia, leishmaniasis is more easily diagnosed and treated. The World Health Organization recommends ambisome that is administered as one single infusion over 2 hours. The recovery rate is more than 98%. It's already being used in national programs in India and Bangladesh. Unfortunately, ambisome is not heat tolerant and is only administered intravenously.
Pros and cons. Pros. Cure rates are high with appropriate medication, mostly when the treatment is started before it affects the immune system. Cons. They are constrained in the people with kidney, liver, and heart failure and is thus affected by tuberculosis. Patients with drug-resistant viral leishmaniasis may require removal of the spleen.
Treatment of cutaneous leishmaniasis is based on whether the infection is uncomplicated or complicated. Localized, uncomplicated disease is treated with topical therapy and include cryotherapy, thermotherapy, antibiotic ointment, paromomycin, and intralesional injections with pentavalent antimony. All of these methods provide faster healing, reduced scarring, and decreased recurrence. In contrast, complicated disease requires systemic therapy. Cutaneous leishmaniasis is considered complicated in the following circumstances: when the host is immunocompromised, when the lesions are large, greater than 5 centimeters, when the lesions are localized areas that are not amenable to local therapy, for example, the face, when there are multiple lesions, greater than 3, when there is mucosal or lymph node involvement, or if they have failed prior local therapy. These treatments include oral azoles, oral miltefosine, IV pentavalent antimony, IV amphotericin B, and IV pentamidine. Treatment of visceral leishmaniasis requires systemic therapy with many of the therapies mentioned with the exception of oral azoles and IV pentamidine. In addition, IV paromomycin may also be used. Unfortunately, many of these treatments are expensive, difficult to obtain in resource-limited settings, and have significant toxicities. Post-Kala-Azar dermal leishmaniasis, or PKDL, is a consequence of visceral leishmaniasis treatment. PKDL is a maculopapular rash that appears months to years after systemic therapy. It is theorized that PKDL is an immune reaction to surviving parasites in the skin. These lesions contain masses of mastocytes. In some cases, PKDL will self-resolve, but oftentimes it requires additional systemic therapy. Several preventative measures for leishmaniasis are available. Vector control includes indoor residual insecticide spraying and insecticide-treated bed nets. Personal protection with insect repellent and insecticide-treated clothing is recommended for travelers to leishmaniasis endemic regions. Lastly, treatment of human reservoirs can help break the life cycle of transmission in leishmaniasis.
Issue applied in Ecuador. The incidence of leishmaniasis has increased with the opening of the new rules, deforestation, urbanization of ports in the neighboring areas. Sonia Zapata, a researcher of the Institute of the Microbiology of the San Francisco de Quito University, who told us that the actuality states are not known because not all cases are reported. Currently, the country only presents cutaneous and mucocutaneous leishmaniasis with cause ulcerate in the mosquito bite, and in the most serious cases, deformed in the affected areas.
It was in Bengal, situated between India and Bangladesh, that a mysterious illness was seen for the first time in 1824. Ashen skin, brittle hair, fever, headaches, weight loss, and death. In 3 years, the epidemic killed almost 750,000 people in the region. The disease, labeled Kala Azar, which means black fever, spread via roads and rivers, with epidemics occurring every 15 to 25 years. During the 20th century, this black fever extended its reach to Asia and to African countries such as Sudan and Ethiopia, along Europe's Mediterranean coast, and to Brazil. In 1900, William Leishman, a Scottish physician, observed the parasite under a microscope while he was examining a patient's spleen. In 1903, the disease began to be treated with antimony salts, which, although extremely toxic, are highly active in combating the parasite. The 1920s saw the development of a much less toxic antimony derivative, pentastane. In 1924, the parasite's vector, the real cause of transmission, a small, biting silvery fly called phlebotomus, was discovered. In the 1950s, the World Health Organization launched a vast DDT insecticide spraying campaign to eradicate malaria. This attempt at eradication failed, but against all expectations, the insecticide proved fatal to the phlebotomus. During the 1960s, Kala Azar seemed to have been eliminated. But as malaria-carrying mosquitoes became increasingly resistant to DDT, at the beginning of the 1970s, spraying was abandoned. The phlebotomus, the Kala Azar vector, proliferated yet again, and there was a surge in widespread deadly epidemics. Between 1977 and 1980, 300,000 people contracted the disease during an outbreak in India. From 1984 to 1994, while civil war raged in Sudan, 100,000 people succumbed to black fever. The disease continues to kill between 20,000 and 30,000 people every year.
Conclusion. Leishmania are a group of diseases caused by protozoa of the genus Leishmania, Cutaneous lesions appear maybe in exposed areas and tend to heal spontaneously, believed scars. Diagnosis is often difficult due to no specific clinical manifestations and the slow growth of the parasite when the culture. There are different avoid treatment options, and each cause should be individually considered, taking into account the characteristics of the lesions, the special species of leishmania, and the potential for mucosal spread.
Cutaneous leishmaniasis is a neglected tropical disease that is on the rise here in Costa Rica. It is caused by a parasite that is transmitted to humans from the bite of an infected sandfly. Within 5 years, the number of cases have almost tripled to about 2,000 per year, with a fatality rate of 7%. About 20% of these cases happen right here in Talamanca, which you can see depicted in the dark red on the map to the left. We have the highest rate of leishmaniasis in Costa Rica. But leishmaniasis also affects many other countries in Central and South America, as you can see. As the Talamancan Health Department, we are working to address this disease and reduce the rising incidence rate through our new campaign, Avoid, Repel, Report. Avoid. Avoid the sandfly bite by using bed nets. Each regional health department here in Talamanca will provide free bed nets for children under the age of 10, for those in need. Close up any small holes or openings that would allow sandflies in the house. We will have our community health workers not only working on reducing mosquito breeding grounds, but they will also be going out and inspecting your homes to see where sandflies might be able to get in. Remember, sandflies are smaller than mosquitoes. Lastly, to avoid a sandfly bite, when going outside, show as minimal skin as possible. Wear long sleeves and long pants. Repel. Repel the sandflies by wearing insect repellent. We will be spraying insecticides in communities with high rates of leishmaniasis and sandflies. Spray your own homes with insecticides, but please use caution. Contact us if you need help or have any questions about treating your homes. Report. Report any signs of leishmaniasis, such as skin lesions, which may start as small, raised, solid pimples in the form of a rash. The earlier diagnosis can prevent more transmission of the disease to more sandflies, which can then infect more people. Therefore, visit your local clinic or any community health worker in the area if you believe you may have contracted leishmaniasis. And remember, please educate your neighbor. So, to avoid the image on the right, let's work on preventing the leishmaniasis parasite. Remember, the cause is a sandfly bite, so spray insecticides to prevent the fly outright. Close up small holes to stop it from taking flight. When outdoors, do not show skin to hold off the sandfly's appetite. Avoid going out at dawn and dusk, so stay in tonight. And never forget to use insect repellent to fight the sandfly bite. In our effort to reduce leishmaniasis here in Talamanca, don't forget, avoid, repel, report.
Thank you.